Hello, everyone. My name is Emily Estes. I'm a student at Frontier Nursing University, and I'm in their nurse midwifery program. I was interested in if there was a relationship of breastfeeding on postpartum hemorrhaging, what kind of impact breastfeeding had, and I wanted to talk about it and see what we as nurses and nurse practitioners, nurse midwives, what all we can do to foster this relationship. So, pretty much a postpartum hemorrhage is heavy bleeding after the birth of a child, and anybody who has just been through labor is at risk. It can lead to long term effects on the mother and the baby, and it can also lead to the mother's death. Right after delivery, as soon as the baby's out, the immediate focus is turned to the mother and preventing her from having too much bleeding. This is usually done through fundal massage. It can be just fundal, or it can be bimanual uterine massage. Also, oxytocin in the form of Pitocin is frequently used. But there are also some other things we can do to help our bodies naturally combat and prevent postpartum hemorrhaging. So the purpose of this is just to understand the risk and the effects of postpartum hemorrhaging, um, figure out what we can do in addition to traditional therapies, and breastfeeding and postpartum hemorrhage. So breastfeeding is practiced not only among humans, we see it in animals, and it's a very natural and cost-effective and beneficial way for a newborn to receive the proper nutrition through their mother's breast milk. Breastfeeding is synonymous with nursing, and it's frequently become a more popular topic in our society, and it's highly encouraged by pediatricians and healthcare providers. So basically, some of the benefits of breastfeeding include that it is a proper nutrition for an infant to help meet their growth and developmental needs. The infant can also receive passive immunity through antibodies found in the breast milk. There is a reduction in the risk of short-term and long-term health problems in babies, and this carries into their childhood. And there's a reduced risk of breast and ovarian cancers in the women, so the mothers that are breastfeeding. And also, there is this possibility that they can possibly lose some of that pregnancy weight gain a little more easily. One of the most important things as a benefit of breastfeeding is it is asserted among women healthcare practitioners that nursing reduces a woman's likelihood for postpartum hemorrhaging. So, one important concept that I discovered was pronurturance. So, pronurturance, I'd never heard of it before, but it refers to skin to skin and breastfeeding. And this occurs when the baby immediately after birth is placed on the mother's bare chest in a manner that they are positioned towards the nipple and where they can find it and hopefully begin suckling and breastfeeding. So, in an ideal, healthy, undisturbed birth where the newborn and the mother are healthy and they're allowed to remain in close skin to skin contact. Subsequently, the infant should, if the mother chooses to do so and breastfeed, the infant should go up towards the breast and begin breastfeeding. And during this time, there will be a surge in the release of oxytocin and the And this is while the mother and the infant are under the influence of their parasympathetic nervous and hormonal systems. And the main function of this oxytocin uptake at the myometrium is to generate strong uterine contractions. And those contractions are going to help squeeze down on that uterus and try to prevent bleeding. Some maternal adaptations to breastfeeding. So there is the physical hormonal process, but there's also emotions experienced through bonding and along with skin to skin. These also help the mother feel more connected and help with that release of oxytocin. Adversely, there was a study that explained that the separation of the mother and the infant after birth can produce an anxious and alert and almost fearful state, and therefore consequently oxytocin would be inhibited and may result in the uterus not contracting down and not becoming firm. Therefore, those present for the labor and delivery, whether it be the healthcare providers or the family, they should do their best to encourage a calm and connected environment and try to keep the baby and the mother as close together as possible. Try not to separate them. In doing so, the pro-nurturants may be initiated and foster serenity and stimulate that oxytocin release, optimal uterine contractions, and thus preventing atonic postpartum hemorrhage. It is reiterated that oxytocin peaks immediately following the physiologic birth, and this, in fact, does reduce the likelihood of excessive bleeding. It also prepares the woman for longer-term maternal adaptations for the newborn and her own well-being. So we have immediate and long-term effects. So what are the implications for practitioners? What does the evidence say? It is a fact that breastfeeding releases oxytocin. We've talked about that. We know that. And oxytocin, in fact, does help with contractions to return the uterus to normal size over time and decrease the amount of bleeding for a postpartum woman. A specific study did show that women who did not do skin-to-skin in breastfeeding were almost as likely, twice as likely to have a postpartum hemorrhage compared to the women that did have skin-to-skin and breastfeeding. So that's a pretty astronomical difference there, almost double the risk. However, on the other hand, there was another study that showed there were no clear effects of breastfeeding on blood loss following the second stage of labor or postpartum hemorrhages. So additional evidence would be needed from very high caliber studies. Nonetheless, nothing is going to be hurt by breastfeeding, obviously. So breastfeeding following the birth does definitely create a physiological effect in the mother and baby and reduce the risk for postpartum hemorrhage. So what do we do for the mother? How do we give her this emotional support? How do we encourage this bond? Due to the maternal infant physiologic and hormonal responses to birth and pronutrients, it stands to reason that all childbearing women should be educated about this. They should be encouraged to allow the immediate placement of the infant on their chest, should be encouraged to promote breastfeeding as soon as possible after birth. Practitioners should always support women in their decisions regarding their labor and delivery preferences, no matter what. But they should also make sure that a mother that's wanting to get pregnant, is pregnant, thinking about get pregnant, that they know about the pros and cons and these physiological and hormonal responses. They need to be able to make educated decisions about their health care. So basically, there is no way that anyone can prevent a postpartum hemorrhage, and there's no way you can 100% avoid it. However, research shows us that a woman's natural intrinsic physiologic response is having that escalated connected feeling with breastfeeding and therefore an oxytocin release. This results in physical responses that prevent excessive bleeding due to the contractions of the uterus. But breastfeeding single-handedly is not going to result in the prevention of postpartum hemorrhages. It's not single-handedly going to result in hormonal release or a connected response. So there is other things we need to do just to foster that relationship between mother and child. But even though we do not know 100% that breastfeeding prevents hemorrhage, we do know that there is a cause and effect relationship, much similar to uterotonic agents that are also used during and after birth. We can reiterate, though, that promotion support of the hormonally driven processes during the early postpartum period should definitely be acknowledged as the basis of care objectives for all healthy women and newborns. So research says that we should support and encourage and educate skin-to-skin breastfeeding bonding. It's not only good for the mother and baby emotionally, it also physically, in the immediate postpartum period through postpartum hemorrhage prevention, but also long-term effects with other issues with their health. I thank you all for your time, and let's go out there and try to educate all of the women in our society and help them make educated decisions for themselves and their children. Thank you.